So good morning, everyone. Buenos dias. Thank you so much for taking time to be here today. I'm Michelle Quesada, the Vice President of Communications for Planned Parenthood of South, East, and North Florida. Soy la Vicepresidente de Comunicaciones, Michelle Quesada, de Planned Parenthood of South, East, and North Florida. This morning, we're going to have remarks first from our President and CEO, Alexandra Mandado, followed by our physician, Dr. Daniels, Chelsea Daniels. And then we'll have a couple remarks in Spanish that I'll be able to give you, and Dr. Daniels will also speak. And then we'll have room for questions. So with that, I'll pass it over to Alex.
Good morning, and thank you all for taking the time to be here with us today. And we continue to have this coverage of this historic setback in access to reproductive health care. Today, the most restrictive abortion ban our state has ever seen went into effect. A law that bans abortion before many people even know that they're pregnant. There is no medical or scientific basis for implementing such a law. The reality is that politicians without medical degrees are making decisions about our health care and inserting themselves in our patient exam rooms to control our bodies and our futures. Since the fall of Roe v. Wade, there has been a national trend of government interference in private medical decisions, and Floridians must stand up against this. To access abortion care, a patient now has less than 14 days after a missed period to confirm they are pregnant, to take off time from work, or arrange child care if they are seeking to have an abortion, and forced to wait 24 hours for a two in-person appointments at least 24 hours apart. Floridians who are more than 6 weeks pregnant and don't meet the state-enforced requirements for the very limited exceptions in the law have nowhere else to go in our region. Florida is among 21 states where abortion bans are in place, denying more than 1 in 3 women, plus more transgender and gender nonconforming people, access to care. There aren't enough states left with abortion access to absorb tens of thousands of patients. With this 6-week ban, there will be an abortion desert in the south of our country, further worsening the national public health crisis created by the fall of Roe. Patients are now forced to travel thousands of miles away from their support systems, their own providers that they trust, just because Florida's government doesn't trust them to make decisions with their families and their providers. The fact is, we see patients of all backgrounds and of all walks of life. We can never know what someone else is going through. We are not in their shoes. That is why it's so important Floridians to keep the government out of our exam rooms and make sure Florida families and the doctors who treat them can make the decisions that are right for them. So at this point, I'd like to introduce one of our dedicated and compassionate physicians, Dr. Chelsea Daniels, who has not only been a champion advocate for our patients in our health centers, but also in front of the cameras, speaking out against the harm politicians are causing on real families here in Florida. Thank you.
Good morning, everyone. Thank you so much to my CEO, Alex. My name is Chelsea Daniels. I am a board-certified physician, and I specialize in reproductive health and family planning. I, like all physicians, took a Hippocratic oath on my very first day of medical school many, many years ago. And in swearing this oath, I committed to minimize patient suffering and to prioritize the health and safety of my patients. And I can tell you beyond a shadow of a doubt that abortion restrictions, like our prior 15-week ban and now our current 6-week ban, legally force me and other physicians to do the opposite of what we have sworn to do. I find myself emotional and enraged these days because we are putting patients through unnecessary anguish and distress to receive what is basic, essential medical care. And that is only going to continue as we impose further restrictions here in Florida and throughout the United States. Due to these unnecessary barriers, we have already begun to have to redirect patients out of state. And in the coming days, weeks, and months, we are going to be navigating thousands of patients to nearby states. And let's be clear, these states are not nearby. These are hundreds and thousands of miles away. So we are asking of our patients a really unimaginable task. There are so many reasons why patients seek abortion care, and they are all valid, and they are all extremely personal. And I want to share a patient story that I think it can really resonated with me and will resonate with y'all. So recently, I had a patient come in. She was okay.
We cut this off. Yeah.
Please don't ring the doorbell.
No, it's okay. If you hear somebody pushing, if you
If somebody knocks, just open the door.
Thanks, appreciate it.
Live TV.
Don't worry.
No, it's okay. So I just want to share this patient story that I found especially impactful, especially in light of the bans that we are seeing. So this was a patient who came to me with her partner and her newborn, who was about 6 months old. So she is in the initial postpartum period, which means that her bleeding is extremely irregular after giving birth. And on top of that, she's been regularly breastfeeding. And breastfeeding can cause menstrual cycles to cease entirely. And for that reason, breastfeeding has historically been used as a form of contraception. So she had no reason to worry. She wasn't bleeding regularly, if at all. However, she started to feel a little off, a little more tired than usual, a little nauseous, but didn't think anything of it. She had a 6-month-old at home. But something told her to take a pregnancy test, and she did. And she was shocked when it came back positive. She was able to get in to see us. She was about 8 weeks pregnant at this point. And that is very early in pregnancy. That means that if she were having periods, she only just missed her period a few weeks prior. And she wasn't having periods. So the fact that she knew and was able to seek care is truly astounding. And because this was several months ago, we were able to provide her with the care that she needed in a timely manner. However, if I were to see that same patient today, I would have to look her in the eyes and tell her, I have the education and the experience and the training to provide you with this essential care, and now I have to ask you to travel hundreds and thousands of miles, to take time off work, to travel with your newborn in order to receive basic medical care. There's also a stark reality that we have already seen play out across the country and here in Florida that is only going to continue to worsen, and that is that a 6-week ban, any abortion ban, impacts more than just those seeking abortion care. We have seen women with wanted pregnancies who have unexpectedly needed life-saving abortion care due to unforeseen complications or tragic fetal diagnoses, and they are being denied that care. It is truly a terrifying time to be a pregnant person in Florida. And that is the devastating reality, and why it is so important for Floridians to vote yes on Amendment 4 this November. We have to limit government interference in decisions that should be left to be made between patients and their doctors. This is more important than ever because this is basic medical care, plain and simple. Thank you so much.
At this time, I'll make a few brief remarks in Spanish, and then Dr. Daniels will also address Spanish viewers, and then we'll take some questions. Buenos días a todos. Gracias por estar con nosotros en este tiempo. Gracias por su continua cobertura de lo que está pasando en nuestro estado en estos momentos. Hoy entra en vigor la prohibición más restrictiva del aborto que jamás hemos visto en nuestro estado. Una ley que prohíbe el aborto antes de que muchas personas ni siquiera sepan que están embarazadas. No hay ninguna base médica o científica para la aplicación de esta ley. Los políticos sin títulos médicos están tomando decisiones sobre nuestra salud y para controlar nuestros cuerpos y nuestros futuros. Desde la caída de Roe contra Wade, ha habido una tendencia nacional de interferencia del gobierno en las decisiones médicas privadas y los floridanos deben oponerse a esto. El gobierno de Florida no permite que las mujeres tomen sus propias decisiones con sus familias y sus proveedores médicos. Para tener acceso a la atención del aborto, una paciente ahora tiene menos de 14 días después de la ausencia de su menstruación para confirmar que está embarazada, tomar tiempo libre de trabajo o encontrar cuidado para sus hijos, si los tiene, para intentar tener un aborto. Y un periodo de demora forzada del Estado que requiere 2 citas en persona con al menos 24 horas de diferencia. Las mujeres que tienen más de 6 semanas de embarazo y no cumplen los requisitos exigidos. Oh, wait a second. Okay. Las mujeres que tienen más de 6 semanas de embarazo y no cumplen los requisitos exigidos por el Estado, con las muy limitadas excepciones de la ley, no tienen a dónde ir en nuestra región. Florida ahora se encuentra entre los 21 estados en los que está prohibido el aborto, lo que niega a más de 1 de cada 3 mujeres el acceso a la atención médica. No hay suficientes estados que tienen acceso al aborto para absorber las decenas de miles de pacientes que van a necesitar esta ayuda. Con esta prohibición de 6 semanas, habrá un desierto de abortos en el sur de nuestro país, empeorando aún más la crisis nacional de salud pública creada por la anulación de Roe contra Wade. Ahora las pacientes se ven obligadas a viajar miles de kilómetros lejos de sus sistemas de apoyo, de sus propios proveedores médicos en los que confían, porque el gobierno de Florida no confía en ellas para tomar estas decisiones de su salud. La realidad es que vemos a pacientes de todo tipo y con situaciones personales muy diferentes. Nunca podemos saber lo que una persona está pasando ni podemos estar en su lugar. Por eso es tan importante para los floridanos mantener al gobierno fuera de nuestras salas de examen y mantener al gobierno lejos de estas decisiones de nuestras privadas. Gracias. Doctora Chelsea ahora va a dar unos cuantos...
Hola otra vez, buenos días. Mi nombre es Chelsea Daniels. Soy médico especializada en salud reproductiva y planificación familiar. Como médico que hizo un juramento hipocrático de hacer lo correcto por mis pacientes, minimizar el sufrimiento y mantener sus intereses en la más alta consideración, puedo decirles que esta prohibición de 6 semanas obliga legalmente a los médicos a hacer lo contrario de lo que hemos jurado hacer. Ya hemos visto pacientes sufrir angustia y sufrimiento innecesarios durante la prohibición al aborto de las 15 semanas. Y esta prohibición de 6 semanas va a seguir a causar más sufrimiento innecesario. Hace poco tuve una paciente que vino con su pareja y su recién nacido de unos 6 meses. El hecho de que ha estado amamantando y todavía está en la fase inicial posparto, su sangramiento empezó como un manchado y ha disminuyendo, lo cual es muy habitual después de dar la luz. Las mujeres que dan el pecho no suelen sangrar y la lactancia se ha utilizado históricamente como método anticonceptivo porque puede interrumpir los ciclos menstruales. Así que ella no creía que tuviera motivos para preocuparse. Empezó a sentirse un poco rara, más cansada de lo normal, aunque con un recién nacido se esperaba. Sintió náuseas y se hizo una prueba de embarazo. Para su sorpresa, el resultado fue positivo. Ella no tenía ni idea de cuándo se había quedado embarazada, ya que no le bajaba la regla, así que concertó una cita con nosotros para aclarar las cosas. Estaba embarazada casi 8 semanas. Si esto ocurriera hoy, tendría que decirle que aunque yo tengo la capacidad y la experiencia para ayudarla, la ley no me lo permite. Tendría que atravesar varios estados, probablemente con un recién nacido, para acceder a un aborto. También es una cruda realidad que la prohibición de las 6 semanas afecta a más personas que las que buscan atención para abortar. Hemos visto a mujeres con embarazos muy deseados que han necesitado atención abortiva para salvar su vida debido a complicaciones imprevistas o diagnósticos fetales mortales. Es un momento verdaderamente aterrador para ser una persona embarazada en Florida. Esa es la devastadora realidad y por qué es tan importante que los floridanos voten sí a la enmienda 4 este noviembre. Tenemos que limitar la interferencia del gobierno en las decisiones que deben ser tomadas entre los pacientes y sus médicos. Gracias.
Gracias, doctora Daniels. At this time, we'll take any questions. We also have a patient navigator here, Elizabeth Londono, and we have our Vice President of Public Policy who can also answer questions.
Quisiera preguntarle acerca de las declaraciones de Donald Trump en la revista Time. Yo sé que no contestan a declaraciones políticas. Sin embargo, yo como mujer sí que me preocupa lo que ha dicho, porque ha dicho que plantea monitorear a las mujeres embarazadas por si abortan o no abortan. Sí que dijo anteriormente que derivaba esa decisión a los estados. Sin embargo, en esa entrevista está diciendo que va a monitorearnos para ver si abortamos o no y ahí emprender acciones legales.
Bueno, lo importante es que nosotros hemos visto mucha interferencia de los políticos en nuestras decisiones sobre nuestra salud, ¿verdad? Y lo que nosotros tenemos que hacer en la Florida es votar sí en el noviembre para proteger los derechos de las mujeres a su salud reproductiva. Entonces, cuando el expresidente dijo que bueno, es para los estados a decidir, nosotros vamos a decir que sí, que nosotros no queremos más interferencia en nuestras decisiones, porque realmente ningún político debe estar entre una paciente y sus decisiones. Eso debe ser entre un médico, la paciente, bueno, y su familia, si quiere. Pero realmente lo que ha pasado es que ahora en todo el sur realmente es muy difícil obtener un aborto. Y nosotros tenemos que cambiar eso en noviembre con votar por la enmienda 4, que va a prevenir el gobierno de hacer leyes que restringe el aborto. I think I said that right.
I have a question
Yeah.
regarding patient options. What are the options now? And will Planned Parenthood provide resources, or is Planned Parenthood working with other organizations to provide resources?
Do you want to answer that, Alex?
Okay. Good morning. Good morning. I'm the patient navigator. My name is Betsy Londono. So the question was, what are their options? So after their 6 weeks, they have no options but to travel out of state. So we are working with our other affiliates, mainly in North Carolina, Virginia, the Northeast, Illinois, to just provide them the safest way to get to those states to receive care.
And how are you doing that? Are you providing money or what?
Both. It depends on every situation. So we're going to work with our funding, with our internal funding, with different abortion funds, working with funds in other states. So it's going to be a case-by-case basis.
Do you recommend that women, is there a number they should call? Who should they reach out to specifically?
On our website, we have a patient navigation line. So if they come to Planned Parenthood seeking abortion care and they receive their ultrasound and they're measuring over 6 weeks, they're given a resource sheet about all the states that are available to them, our phone number, different websites with different choices. So if they reach out to us, to our patient navigation team, that's when we take the ball from them and we help them to get where they need to go.
How many women did you have come in, say, yesterday or today that are over the line and have to go out of state?
Yeah, we've seen dozens of patients at several of our health centers throughout the last couple of days and really just the entire month of April. We've already seen several women. I think yesterday Dr. Daniels said almost all of the patients that came in yesterday for abortion consultations were over 6 weeks pregnant. And so these are all women that were connected with our patient navigators to be able to receive access to care in other states. I also wanted to add on to what Betsy was saying. There's also abortionfinder.org and chatwithcharlie.org. Those are also great options and platforms for patients to be able to find abortion care and access to abortion care. As you can imagine, we're going to have a tremendous patient volume that we're helping navigate to other states. So our patient navigation team is fantastic. I want patients to take advantage of any opportunity that they can to connect to resources in other states. And that also means that if they can't get an appointment for pregnancy confirmation right away with our health centers, that they see the first provider that they can get in with.
¿Podría decir eso en español, por favor?
What it's been like the past couple of days and las opciones de los pacientes.
Claro, en los últimos días hemos visto docenas de pacientes en cada de nuestros centros de salud que han tenido que ir a conectarse con nuestros navegadores de pacientes para ir a otros estados. Sabemos que ayer teníamos pacientes aquí mismo en este centro de salud y la mayoría de ellos ya estaban más de 6 semanas embarazadas. Entonces lo que estamos haciendo es conectando a los pacientes con nuestros navegadores de pacientes que pueden conectarlas con acceso, recursos en otros estados. También hay el sitio de web abortionfinder.org y chatwithcharlie.org que también son recursos para que los pacientes puedan encontrar acceso en su estado, en un estado que pueda acceder al acceso. Y le estamos diciendo a los pacientes que si no pueden conseguir cita para confirmar un embarazo con nosotros, que por favor que lleguen a cualquier proveedor que los pueda ver para confirmar embarazo y saber qué tal tiempo tienen embarazadas.
¿Ustedes tienen estadísticas más o menos al año cuántos abortos se han realizado?
En el estado de la Florida el año pasado, 84,000 abortos se realizaron en este estado.
Con respecto al anterior año, 2022.
23.
¿Y el 2022 tiene esa cifra?
No tengo.
Comparativa justamente después de Roe versus Wade.
No lo tengo. Lo puede buscar en el sitio de Agency for Healthcare Administration. Ellos tienen todos los datos que colectan en el estado completo.
Could you clarify the abortion pill situation? A lot of women seem to think that they can receive it through the mail. Is that allowed now?
Yes. So it's illegal in Florida to mail abortion pills. In Florida, it's required that you have 2 in-person appointments 24 hours apart in order to obtain medication abortion. In other states, it is legal for them to mail abortion pills, so that's where I think the confusion lies. I don't know how other states are doing. I've heard that they're marketing to patients and people in Florida, but as far as we know, we have to have a patient come in, they have to be under 6 weeks, and they have to have 2 in-person appointments in order to get a prescription for medication abortion.
Morgan Reiner with CBS. Thank you for taking our questions. My question is for the provider. Can you please talk to us about the exceptions that are in place with this ban, and as a provider, how you navigate them and whether you find them confusing?
Chelsea, you want to? And you can repeat the question.
Okay. So the question was about the exceptions in the ban, how we navigate them, and whether I, as a physician, find them confusing. So just to start, yes, I find them extremely confusing, and I think most doctors do, because exception language, when we think of exception language in abortion bans, these exceptions are written by people who have no medical background and who are basing their legislative language not in medicine or in science. So the exceptions that exist in this ban are up to 15 weeks of pregnancy if you have been raped, sexually trafficked, or are a victim of incest. And then the other exceptions that exist are fatal fetal anomaly and health of the life of the mother being at stake. So to talk about each of those, so the first one, up to 15 weeks, you have the option for an abortion if you've been a victim of rape, incest, or human trafficking. The way that the law is written requires documentation of that, so either a restraining order or a police report or other criminal documentation. And we know that only about 1 in 3 people who are victims of rape, for instance, will report. And even if you have reported, are you able to gather all of the necessary documentation necessary in order to obtain this care by 15 weeks? The answer is probably not. So this is not an exception. This is just a further burden on patients who have already been extremely violated and marginalized.
¿Podrías decir eso en español?
Sí. No, está bien. Todo que lo dije. Sí. Sobre las excepciones. Ok, so, entonces, sí, las excepciones son bastante difíciles para interpretar y la razón es porque están escritos por personas que no tienen la habilidad a escribirles en medicina y en ciencia, porque no son doctoras. Y, por ejemplo, las excepciones dicen que puede tener un aborto hasta 15 semanas si tú eres la víctima de una violación o de, ¿cómo se dice? Incesto, no sé. Incesto, gracias. Pero necesita mostrar papeles como un restraining order o como papeles de la policía. ¿Cómo? Denuncio. Gracias.
Tienes que tener una denuncia de policía, un documento de corte o un récord de su hospital o de su médico para poder acceder al aborto.
Gracias. Y necesita tener todos estos papeles por su doctora antes de 15 semanas. Y ya sabemos que personas que han estado violadas no quieren ir a la policía porque es algo que ya es bastante difícil y ahora necesita tener todas estas conversaciones con otras personas para recibir el cuidado que necesitan.
Dr. Daniels, I was hoping you might be able to speak to, so as we've been approaching today, what it's been like for you as a physician to think about, you mentioned in your remarks, having to tell patients my only option is basically to send you out of state. What has it been like for you as a doctor thinking about, as we approach today, what those conversations look like and like how you've thought about translating this sort of massive change in care to your patients?
Yeah, it's been really challenging, and I get very choked up talking about it and thinking about it because I'm in clinic this morning upstairs and was just running down because we are having patients who are 6 weeks, 4 days pregnant, 6 weeks, 3 days pregnant, and we are telling them we can't help them. And I've spent my life and my career doing this, and I have the training to do this, and I have people who do not have the training or the expertise or the knowledge to do this telling me that I can't. And more importantly, telling women that their reproductive freedoms and their bodily autonomy don't matter. And what matters is their political aims by bad actors. And that is a really challenging reality for me, not just as a physician or an abortion provider, but as a person and as a woman and as someone who could become pregnant in the state of Florida.
Perjudica esta ley y sobre todo a las personas vulnerables que no pueden viajar porque económicamente no se lo pueden permitir, con lo cual las está condenando a tener embarazos no deseados, entre otras cosas.
Sí, es bastante difícil para alguna persona viajar si necesita, porque quizás no tiene la habilidad a tomar días del trabajo, quizás tiene un recién nacido, como yo dije, y ahora estamos preguntando por días de la vida de la persona para viajar por cuidado, que es necesario y que debe estar disponible aquí en Florida. Y en los casos donde una persona quiere estar embarazada, pero hay más riesgo, hay complicaciones, lo que puede pasar, es posible que no puede recibir este cuidado aquí en Florida porque, como yo ya dije, las excepciones no son claras y doctores tienen miedo para hacer todas las cosas para ayudar pacientes cuando la ley no es clara.
Dr. Daniels, for the fatal anomaly exception, could you walk us through if a woman has this happening, what happens?
Yeah, so I think the first thing that is important to recognize is that we don't start any kind of formal genetic testing or anomalous anatomical testing until later in pregnancy. The first time we can offer any kind of testing is around 10 weeks of pregnancy, and that's with a blood test. And that is going to test for the most common chromosomal abnormalities. So that doesn't happen until 10 weeks, which is 4 weeks past a ban. So you don't even have any necessary information. Then the next testing that we offer is what we call an anatomy scan. So this is an ultrasound to assess for fetal anatomy, and that doesn't happen until about 18 to 22 weeks. So again, you can see that patients are being forced to make decisions without all necessary information when any ban is in place, but particularly a 6-week ban like this.
The way. I'm sorry.
I was going to say the way that the fetal anomaly language is written is just like the way that the threat to the health of life of the mother is written is extremely vague and difficult to interpret. Because how do you define a fetal anomaly as meaning that a fetus at the time of birth could survive for an hour or a day? Do you define life-threatening circumstances to the life of the mother as a 51% chance of survival or a 30% chance of survival. I mean, that calculus is not possible, number one. It's not medically sound. And number two, I think that we're already seeing in other states with restrictions like this, doctors making really challenging decisions because they're afraid of criminal penalty.
And just following up on that real quick, in the case of a miscarriage, that the baby is not viable, the fetus is not viable, is there a question about that too? Because I had an interview that alluded to that she wouldn't be able to take care of it medically, she would have to wait. Could you explain that?
So if a fetus is not viable, meaning that there is no cardiac activity, this is most commonly seen in the first trimester, and that is considered a miscarriage, and so we are still legally able to provide that care. I think where miscarriage management becomes much murkier with these laws is when you have second trimester or even third trimester care where the water has broken early, or there are other abnormalities in the pregnancy, but just with the water breaking early. This is something we see not uncommonly. And when the water breaks, that exposes the pregnant person to infection. When this is happening to people and they're seeking care, they are being turned away because even if this is a pregnancy that is pre-viable, is early, and is putting the life of the pregnant person at stake, doctors are too afraid to intervene, and patients are often waiting and waiting until they become infected in order to feel that the law can intervene. And that is because of the murkiness surrounding the language.
You want to just add the two doctors?
Yes. So to the prior question is that in order for the exception language around health of the life of the mother and fatal fetal anomaly, you need a two-doctor consent, which is, I think I can make my own medical decisions, and I think most doctors feel that way because we've spent our lives doing this. And I make my own medical decisions for my patients all day long, and I don't feel that I need legislators to tell me what to do.
Could you say that in Spanish, please?
Yes. ¿Todo o cómo? La última parte.
La última parte.
Okay. Que en la ley, las excepciones dicen que necesita dos doctoras, dos médicos, para decir si las excepciones son bienes en las situaciones donde hay un problema con la salud de la madre o con el feto. Y yo pienso que yo puedo hacer mis decisiones médicos porque yo hago decisiones médicos solo todo el día y yo hago estas decisiones sobre todos mis pacientes todo el día y no necesito el gobierno a decirme que necesito hablar con otros para hacer estas decisiones.
What's been the conversation with North Carolina and Virginia, your partners there? Can they handle what is potentially coming towards them of an entire state to potentially need to go in there?
Well, we're going to find out. So, yes, we have been in contact with them all this past year preparing. So there's several clinics in North Carolina, several clinics in Virginia. They've been handling a lot of the Southeast already. So, again, we're going to find out how it's going to play out, but we have every indication to think that they will be able to handle it and that we're going to do a really good job getting these patients there or helping these patients get there safely.
Alex is going to add to that. My CEO is going to add to that.
Are you going to raise your medical team over there?
Just 1 second. Let's Alex address that.
I think the critical piece, too, to answer your question is there are 84,000 patients who sought abortion care last year. There is no way that the national fabric of abortion care can take care of these women. So when we talk about North Carolina, they have a 12-week ban with a 72-hour waiting period. And Virginia also has access, as we've stated. But at the same time, when we talk about 21 states that have bans or restrictions, where are these women going to go?
Podríamos tener en español que nos diga cuáles serían las opciones que tuvieran las mujeres para irse a otro estado, que tendrían que hacer solamente lo que dijo ella, lo dijo en inglés nada más.
Do you
las
wanna-
opciones.
do you want to say it in Spanish or what you said? Okay. Okay. Lo que dice ella es que sí han estado trabajando, nuestros navegadores de pacientes han estado trabajando con navegadores en otros estados, en otras clínicas en norte de Carolina del Norte, en Virginia, en otros estados, y que se han estado preparando más de un año para esto. Pero a la misma vez lo que dice nuestra presidenta y ejecutiva general aquí de nuestra organización es que 84,000 pacientes recibieron atención de aborto en nuestro estado de Florida el año pasado. Hay 21 estados que ahora restringen el aborto o prohíben el aborto. Nuestro país, los estados que tienen acceso no pueden absorber todos esos pacientes. Entonces vamos a tener mujeres que van a tener tiempo de espera para poder acceder esta atención. Además, Carolina del Norte tiene un tiempo de espera mandatorio de 72 horas. Entonces, y ese es el estado más cercano a nosotros.
How is all this being enforced? Inspections? When you say you have 7 weeks coming in 6 weeks and 3 days, I mean, how is it
Yeah,
being
so we get
enforced?
regular inspections from the Agency for Healthcare Administration, and they're able to audit our files, our patient files, and see when abortions are happening, look at any cases where a miscarriage was handled, at what point in pregnancy was a miscarriage handled, what were the factors in that miscarriage. So yes, we are being watched by agencies, and they are enforcing this.
How frequent are the inspections? Are you going to change now?
They're pretty regular inspections. I mean, this is happening across all health centers across Florida that offer abortion care.
I would just say the important piece of that is that doctors are the ones that are being criminalized. And so they are putting their licenses on the line. And so we have dedicated doctors like Dr. Daniels who's going to care for our patients. But nobody wants to see their doctor risk being thrown in jail for providing the care that the patient in front of them needs. And so that's what is different about treating this type of reproductive health care from other types of health care services.
We'll take 2 more questions if you have them. If not, we'll wrap up.
I'm good.
Thank you so
Great.
much.
Thank you. Thank you all. Appreciate it.
You
Gracias.
came in. ¿Podrías hacer una para referir tu nombre y tu cargo?
Sí, Michelle Quesada, vicepresidente de comunicaciones, y yo le letreo el nombre si quiere. ¿quiere grabarlo? Okay, perfect. Yep. All right, thank you all so much for being here.
Thank you.
I have one favor to ask of the photographers.
Yes.
When you choose B-roll for this story, if we're talking about a specific band, please do not choose a 6-month pregnant woman in your B-roll or showing a full-grown fetus in your B-roll. It's a 6-week band.